Okay, Flo. Patient is here because they have bilateral blurry vision in both eyes. They were referred to by their optometrist for possible cataracts, and the patient is noticing that over the past 2 months or so, the glare has been getting worse. They're having some issues with night driving. Specialty meds wise, the patient's on Sequa 1 drop twice a day for dry eye that they were prescribed. Systemic medications, they're on Crestor 5 milligrams for hyperlipidemia. Surgical history, they had an appendectomy when they were younger. And allergies, they're allergic to cats where they get hives from that. Submit. On exam, I'm going to let it go, but I'm going to keep talking about the exam now. And as you can see, I said submit, so it's going to keep adding the history now, and I'm not doing anything. So now the vision of the patient is about 20/50 in both eyes without glasses, corrects to 20/30 with the refraction of about +3 sphere in the right eye and +2, -2 at 90 in the left eye. Pressures are 14 and 15, and really the rest of the exam is normal. The pupils are normal. Submit. So now we can take a look. Let's just see what. Okay, so it already put in the history. It's putting in the refraction, and it's putting in the rest of the stuff as I'm still talking. So it's going live. So on external exam, we have 2+ blepharitis in both eyes, and we do have 1+ PEE in both eyes, in both corneas, I should say. Cataract-wise, they have 2+ NS in both, and about a 3+ cortical in both eyes. On retina exam, they have a 1+ ERM in the right eye, but otherwise the retina is normal. The cup-disc ratio is about 0.4. Done flow. So the difference there when I said done flow is that it just goes ahead and sends the last audio chunk. I don't expect that I'm gonna have to talk anymore, but you can see it's going there, so it's not recording me anymore. It's just working. So sometimes this is good if you want to kind of take a break, you don't want it to record anymore, you let it keep going. I'm going to keep going though, it can still work while I keep going. Okay, flow. So then when we talk about the impression and plan, for the dry eye, the patient's doing pretty well with the Sequa 1 drop twice a day in both eyes. We should also consider doing artificial tears 4 times a day, especially around the time of cataract surgery. And then for the blepharitis, let's do some eyelid scrubs. Now we're going to talk about the cataracts in a moment, but for the cataracts OD and OS, I am going to want to put in there that we are considering the PureSee IOL, PureSee, or maybe the Odyssey IOL, or maybe the BVI Fine Vision HP. But for the ERM in the right, I am going to have to, there is a diagnosis of an ERM in the right eye. It's mild, but I do want to check with a retina doctor before this. Follow up in a week with me for repeat calculations. Done flow. One of the things it's already putting all the defaults for my impression and plan, but one last thing I want to do is I want to show the images of the retina. Okay, flow. Show me the latest OCT macula in both eyes, and if you can as well, show me the biometry. Done flow. So now we'll just watch it finish. It put in all the things that I wanted into the impression and plan. It's going in there, it's putting in the diagnostics. It put in considering PureSee IOL or BVI. It's now going into the other tab, and it's picking the OCTs in the right and the left so that when we can see them in the main section, and it's also looking at the biometry. So it's able to go across tabs, find the images, put them right eye, put them left eye, so they're nice and aligned up. It's already doing that, and you'll see at the end now it's going back to this tab, and it sorted them all out for us to see and for us to be able to send to the other doctor. Now, I didn't have enough space for the biometry, but you could see that it did put it in there, and you can see it wrote about the epiretinal membrane, the things that we talked about. It put in all the stuff about the cataracts, and we already has the Sequa specialty meds in there that we added. Everything's been done, and I never touched the keyboard or the mouse. Thank you.